Good morning, everyone, and welcome to our third virtual advocacy days. We're going to go ahead and get started. It's 10 o'clock. We're here today to talk about the impact of COVID-19 on our community and talk about some of the drastic economic challenges that we know we're going to face ahead. This is part of a 6-week series discussing impending budget challenges with some key state legislators who are here with us today. My name is Stacy Dim, and I'm the Executive Director of the ARC of Washington State, and I'm co-hosting today with the Washington State Developmental Disabilities Council and Self-Advocates and Leadership, or SAIL. We appreciate that you're all here with us today. We want to remind everyone to be respectful of each other's feelings, of different backgrounds and differences in language, different abilities to communicate. Please think about different perspectives today. We should always assume good intentions from our fellow Zoomers and our fellow legislators. And remember, it takes great courage to share our stories and to speak up. So let's be supportive of each other. I'm excited about this opportunity today. And now I'm going to turn things over to Jessica Renner to share some tips for how we'll be interacting on this webinar. And then we'll get some things going. Jessica, are you ready?
Looks like Jessica might be on mute.
Yeah, Jessica, are you on? Sometimes it takes just a minute to get, there you go, Jessica, you're unmuted.
A few things you need to know before we get started. First, everyone will be muted at the beginning of the webinar. Second, I would like to remind everyone that we are also live streaming these virtual advocacy days on our Facebook page at www.facebook.com/thearc-of-Washington-State. Third, we are also recording each week's presentation and will post the recorded sessions on our website at www.arcwa.org. Fourth, if any of the participants today want to welcome the guests or talk to other attendees, please use the chat box. If you have questions, you can type them in the Q&A box or raise your hand using the icon. Click on the raise hand icon to ask a question, or to post a question. Type it in the Q&A box by clicking the Q&A icon located next to the chat icon in the middle of your toolbar. If you raise your hand, we will unmute you when we call your name. Then you can unmute yourself using the microphone icon on the bottom left side of your toolbar. This will allow you to ask your question. The raise hand icon is located on the bottom right corner under the More option. Please note as a reminder, please hold your questions until later in the program, when we will answer questions posted in the Q&A. If you need clarification on something, post it in the chat box and someone will try to address it. Finally, I want to ask where people are from. Please type what county you are from in the chat box with that. I'll turn it back over to Diana Staton to continue on with our program.
Actually, Jessica, you're going to turn it back over to me. We're going to start with some introductions, and thank you so much for that, Jessica. Just a little bit of information about the organizations that are hosting this event today. I'll start with the ARC. The ARC is a national organization that promotes and protects the human and civil rights of people with intellectual and developmental disabilities, ensuring their full inclusion and participation in all aspects of community. We have 8 local county-based chapters across Washington, and we've been around since 1936. The ARC is known for pioneering innovative programs and services, encouraging progressive governmental policies that promote independence and self-sufficiency and inclusion, and informing and educating society about the enduring potential and inherent value of people with intellectual and developmental disabilities. With that, I'll pass it on to Emily Rogers. Emily, I'll talk a little bit about the Washington State Developmental Disabilities Council. Emily, take it away.
Hello, I'm so glad to see that so many people are here. My name is Emily Rogers, and I work for the Washington State Developmental Disabilities Council. And the council, there's a council in every single state, and it is part of the DD Act. That's where you'll find information about what the council does. Our areas of focus are advocacy, systems change, and community capacity building. And our council members, 66% of the council members need to be people with developmental disabilities or family members. And so that's really good because we're able to get the true perspective of how things impact people and really can help people in their everyday lives. So the things that we work on, the systems change type of things and the advocacy things have to do with improving folks' lives over the long term. We're happy to be here and I'm excited to hear from you all and have a good conversation today. Thank you so much.
Great, thanks so much, Emily. And then we'll turn it back over to Jessica to talk about SAIL. Jessica?
Self-Advocates in Leadership. SAIL is a statewide coalition in Washington state of people with developmental disabilities. The SAIL coalition strives with legislative advocacy to shape public policies that affect the lives of people with developmental disabilities. SAIL meets the second Tuesday of the month on Zoom from 1 to 4. SAIL, along with the ARC of Washington and the DDC, hosts advocacy days each year. SAIL puts together their own legislative priorities and one-pagers each year on the issues that SAIL members think are the most important to share with legislators during the legislative session.
Thank you, Jessica. And now we've got 2 very special legislator guests and another guest that are legislative staff that I'm going to let Diana introduce. Just wanted people to know that in the chat box, we've got people here from all over the state. So we have folks signing in from Pierce County, Kitsap County, Whatcom County, Spokane County. There are people in from Jefferson County, Benton County. We've got quite a crew, Franklin County, so Benton and Franklin. Thank you so much, everybody, for joining. Diana, you want to take it away and introduce our special?
Hi, everybody. I'm Diana Stadden, and I'm with ARC of Washington State. And we have some very special guests with us today. We have Senator Mark Schessler from the 9th District, and we have Representative Skyler Rude from the 16th District. So Senator Schessler, would you like to take a moment and introduce yourself? Oh, okay, there we go.
We might be having a little audio problem with you, Senator Schessler. We can see you, but we can't hear you.
Okay, how's that?
There we go.
Oh, good.
Okay,
Thank you.
well now that I'll see if I can get into a little better light here. Always a few potential technical glitches on these things.
Happens to the best
But
of us.
it's good to be with you today and join my many friends I've worked with during my career in the legislature with the ARC. Whether it's Sharon Adelson and her daughter joining me, or whether it's Debbie Chapman having a chance to talk to me about her sister and others she's worked with, it's very valuable for myself as a legislator. I would say that we're in sort of uncharted waters about budget, COVID, the economy, education. But one thing is absolutely consistent. Anytime the budget's in trouble, scare the heck out of the most vulnerable, use the most vulnerable to your best means, and it's always the same. The worst possible thing you can look at is across the board cuts. Clearly, that's not smart. It's not the priorities of the ARC, not the priorities of most legislators if you're significantly behind. What would have been smart was a June legislative session to get ahead of the curve on the budget. At that point in time, I think pretty much every legislator and the governor said it was inevitable. Now, due to special interests and due to the elections, I don't think there's going to be a special session in the near future, which is only going to compound the issue in January and possibly rush to poorer solutions than we otherwise would have had. So it's a challenge, and I guess I've seen 3 recessions, so it's not my first rodeo. So I'll leave it at that.
Thank you, Senator Schessler. And now we're going to hear from Representative Rude. Would you like to introduce yourself, please?
Sure. Thanks, Diana. Unlike Senator Schessler, this is my first rodeo. I'm a freshman legislator, just wrapping up my first term. I represent the 16th district, which is all of Walla Walla County, all of Columbia County, parts of Benton Franklin. And I could not agree more with everything that the senators said. Much of the state budget, the operating budget, is committed to constitutional obligations, and entering a recession that really ties the hands of the legislature as far as determining what the priorities are. So a lot of what is on the chopping block is social services, higher ed, those areas. So I fully agree that the earlier the legislature reconvenes and starts that process of budget reduction, the better. And the less painful and deep the cuts are going to be farther down the road. So that's really what needs to happen. Unfortunately, the governor has really shut out the legislature from being a partner in that process. And that has created, I can't even begin to communicate the frustration that I'm feeling about that. And Republicans in the House and the Senate have offered to be a partner and to collaborate and develop solutions to addressing the COVID issue and the budget problems, and really haven't been taken up on that offer. So that's where we are right now. But my priority going into any session, whether it's a special session or a regular session in January, is prioritizing services for individuals that are vulnerable, and that can include elderly populations and individuals with developmental and intellectual disabilities. But that's really what we need to do. And kind of coming full circle, I think getting back to Olympia as soon as possible is the best way to protect the services that we're going to be talking about today.
Thank you, Representative Rude. And then we also have a few other guests with us today. James Kettel from Senate Committee Services. Would you like to introduce yourself?
Anna, and good morning, everyone. So my name is James Kettel, and I work for Senate Committee Services. So just a very brief background. So the Senate, of course, has members like Senator Schessler and their aides. There are partisan staff, caucus staff for both the Democrats and Republicans. And there are also nonpartisan staff, and that is where I work, which is Senate Committee Services. Just a little bit about our roles, since some of you may not be as familiar. We provide independent analysis and option development and other support for all members, Republican and Democrat. Most staff in the office work on operating and capital budget issues. The time varies based on their assignment. Some are specialized on things like revenue, again, depending on their assignment. We have lots of collaboration with state agencies and with the Office of Financial Management, the Caseload Forecast Council, Economic and Revenue Forecast Council, as well as with advocates. Lots of our time is spent writing bills, amendments, bill reports, memos, lots of time on quantitative work, forecasts, budget items, and so on. We get formal presentations before committee, lots of informal briefings behind the scenes for budget development, and the culmination, of course, is at the end of session with the budget bill, the appropriations bill, which sets and adjusts appropriations for all aspects of state government. And just a little bit more on myself. So I worked for almost 10 years in DSHS. A lot of that time was spent working on DD issues. I also spent about 4 years working in the House of Representatives, assigned to the Appropriations Committee, also working on DD issues. And then I've been here with the Senate for about 4 years as well. And it's a pleasure to join you all this morning.
Thank you, James. And we have two other guests that are going to be here just kind of to help us answer questions. Luisa, would you like to introduce yourself?
Hi, good morning. My name is Luisa Parada Estrada, and I work for the Developmental Disabilities Administration for DSHS. And there my role is communications and legislative performance unit manager. So my unit does encompass those areas specifically, but I do serve as our legislative liaison or manager for DDA. And it's a pleasure to be here with everybody today. Thank you.
And then we have Beth. Would you like to introduce yourself?
Hi, I am Beth Krehbiel. I'm with the Developmental Disabilities Administration. I am the office chief for Medicaid and eligibility programs. So in my office, we have waiver policy, we have state plan policy, and then some other things that go with that, like Medicaid eligibility. I am just so happy to be here and continue to hear from stakeholders as we go through this unprecedented time and have to put some really, really challenging options for reductions on the table. I hope that I'll be able to answer questions and help folks understand kind of where we are now, and as we learn more on the revenue situation, where we're going forward in the future. Thank you so much.
Thanks, Beth. So now we're going to do a little poll to find out what role the people who are attending have, whether they're a self-advocate, family member, service provider. If you want to go ahead and fill out the poll, and then we'll take a look at it in a minute and see what our audience is consisting of today. Looks like there's a lot of family members, about half of them so far are family members. And unfortunately, the panelists for today, they can't access polling on their screen, but we know that we have some policymakers here joining us today as well. So it looks like it's pretty much stopped. So I'm going to end the polling. And let's see, yep, the family members was about 40% of who's here today. And 18% of them are self-advocates, which we're really glad to see here. We have a few that are allies of the DD movement as well, and then service providers. So we're going to move forward here. Shut the poll down here. And so we've got our introductions out of the way. We're going to start on a couple slides just to let you know what we're looking at for the way of budget cuts. And this is kind of an overall graph that shows where our service is at. And you can see many of them are under the Developmental Disabilities Administration, and that they've proposed a 15% cut to that. But then you can see we also have services in many other administrations, and those are also going to take a 15% cut. So we're actually taking more than 15% just by doing the Developmental Disabilities Administration services. And we also want to remind everybody that all of the services in DDA get a federal match. And so if those services are cut, we're double cutting because they're cutting the state portion and also losing the federal match portion that comes into our state budget. So I'm going to turn this over to Stacy now, and she's going to go through some more of these.
Thanks, Diana. So the next slide you'll see shows our DDA biennial budget with about $1.8 billion in general state funds. And as Diana mentioned, we get about equal that $1.8 billion in federal matching funds, which matters a great deal. Out of an estimated 120,000 people with intellectual and developmental disabilities in our state, there are about almost 50,000 people enrolled, that is eligible for services, asking for services. And of that 50,000, only about 35,000 of those receive at least one paid service. We have 14,000 people who have asked for help from DDA, they're eligible from DDA, and they are waiting for services. This is before COVID, and of course, before we talk about any budget cuts. Just a note, our DDA, state DDA does not provide any housing or crisis emergency services in our state. So the graph next on the left side shows you how much money and what percent is spent on each program provided by DDA. And as you can see, most of the funds are spent on community residential services, and then the other majority are spent on in-home supports and services. So residential services include supported living and other ways that people with developmental disabilities live independently in their own homes in the community. You can see about 13% of the budget is spent on, oops, go back, Diana. About 13% of the budget is spent on RHCs, or our state institutions, and there are about 551 long-term residents in those RHCs. Just a side note, we also have 67 residents in those RHCs ready to leave, but they have no community placement available to them. We also have, at this time, about 7 people stuck in hospitals and about 53 DDA eligible individuals stuck in psychiatric facilities. And we know there are about 256 DDA eligible clients in nursing homes separate from RHCs. Thank you, Diana. So the next slide shows the proposed cuts as part of our 15% exercise. The most important change that you'll see is a reduction in eligibility. So that would reduce the overall number of clients who would be eligible for services. And we know that it would not be a temporary measure. It would take a long time to reverse the effects of changing eligibility. It would cut people from the 5 home and community-based waivers that we have. It would not allow for new placements. The cuts would also propose reducing respite hours for eligible clients. There would be no new children's services, including enhanced respite beds and crisis stabilization for children, which we have slowly been building up over the last couple of legislative sessions. Just a note that respite hours is the most requested service from DDA. The cuts would also propose to cut the supported living rate increase that was made available in the last session. And as many of you know, that we're barely keeping up with the minimum wage and supported living. It would also cut rates to transition clients from hospitals And that would be a 5% rate reduction for individual and group supported employment. So all those graduates that are coming out of high school that we spent a lot of time educating and getting ready for employment would have their services jeopardized, as well as people who are currently in jobs and who are going to be returning to jobs once we move into various phases across counties in our state. And then the next slide is some more proposed cuts that I think Jessica is going to review. Jessica, are you queued up?
It's being proposed for the DDA budget. They include a much needed rate increase for supported living so we can move the 47 plus residents in the RHCs and have a placement in the community for them to move to. It also would cut rates and staffing that is needed to address the crisis of people with AIDS who are stuck in hospitals and need a place to go. A piece that DDA included in their proposal was to close the RHC known as Rainier and consolidate cottages at the other RHCs. Self-advocates are very happy about this, although it won't save money this year. Savings will start showing up in about 2 years.
Thank you, Jessica. And then as we talked about in the other slide, there are services under other agencies that will affect people with developmental disabilities as well. So thank you, Jessica. And we are going to move on to constituents. And we are going to hear from some parents, and we've got one self-advocate today. So Jeanette, would you like to introduce yourself and share your story with Senator Schessler?
Hi, my name is Jeanette Solomini. I live in Colfax, Washington, and I am the mother of 2 adult daughters with disabilities. My older daughter is 22 and she has severe autism and behavioral issues. My younger daughter is 20. She just turned 20 yesterday, and she has Dravet syndrome, a mitochondrial disease, seizures that have never been fully controlled, and an intellectual disability that leaves her at a possibly 2-year-old functioning level. I am a member of the clergy in the United Church of Christ, but I had to stop serving churches as a full-time pastor when it became clear that my daughter's disabilities, when they were young, were going to take much more of my time than we ever imagined. My husband is retired, and we receive Social Security for him. Both my daughters are on SSA and SSI and receive Medicare. I am a paid care provider by the state, and this is how we survive. If the budget cuts happen and they reduce possible care providers for people with disabilities, this could severely affect our income and could also put us back into below poverty living. Since we live in a rural area, we have limited services as it is. My older daughter is currently ready to accept services from Boost Collaborative for community enrichment, but because of the COVID situation, we have had to put that on hold. My younger daughter is medically fragile. My husband is 70, so we are still in a state of quarantine to protect them. COVID has seriously affected our lives. The coming school year, which would be the last school year for my younger daughter, she will probably not go because of the COVID situation and the fact that she is unable to wear a mask, and it would be at risk for her at all times just to be around too many people. At this point in time, the very fact that I am able to provide services to my daughters to take care of them is what is keeping us going. And a reduction of any of those services would, as I said, be devastating. We don't have even my respite care provider coming in an effort to protect my younger daughter, to make sure that she does not get it. I know that Whitman County is actually fairly safe all things considered, but we live much too close to Spokane for our own comfort. We've had to do all of our doctor's appointments online as much as possible because of fear of possibly getting exposed to COVID. The services that the state provides have kept us going. And I don't know what would happen both to my family and to the many families that I know who are taking care of their own children, whether they are still minors or have become adults, and to have the reduction in services that are already so limited. So I'm hoping that through a little bit of compassion and common sense, that the state will see that taking away services that are already limited will only make life much harder for people who are disabled and their families and their care providers. And so I am asking that we keep in mind that people like me and other family members who take care of their disabled family loved ones are keeping the state costs down as it is. And we would hope that the state would not try to balance the budget on the backs of our children and loved ones and on us. If there's anything anybody would like to ask, I'll be glad to answer a question if someone has one.
Thank you, Jeanette. And we're going to give Senator Schessler a few moments to respond to you after we also hear from Chris. Chris, okay. Would you like to introduce yourself and share your story?
Hi, I'm Chris Cachado. I'm the Region 9. I was the Region 9 rep. And yeah, okay, that's pretty much it.
Well, Chris, if these budget cuts were enacted, what services do you have that you would lose, and how would that affect you?
I lose my place to live, I lose my services, and I lose the staff that works with me.
And what would that do to your life?
I would be homeless probably.
Okay, well, thank you, Chris. And I'm sure Senator Schessler will discuss that a little bit with you in a few minutes. Right now, we're going to hear from Nancy Stark, who is a parent in the 16th district. Nancy?
Hi, I've been working on my video here, and I'm not, oh, I'm like a ghost. Today I am representing families in District 16, and my daughter Gretchen is on the autism spectrum, pretty high functioning. She has worked with several agencies on employment, and she has managed to secure her own employment on her own, but she still receives DD oversight and an annual review. Now, Gretchen lives with us. She's 41, and we kind of keep her out of trouble. She doesn't make very good decisions, and so we're on it all the time. Now, we're aging, and we worry about her, you know, people monitoring her after we're gone. And we've looked at that. She does have a sister in the community who's, you know, married and has a family of her own, so she's busy. And I can see Gretchen living in a group home in the future. But, you know, if there's any cuts, she'd be newly entering that system, supported living. So I fear for her future, and her future is coming sooner than I'd like to think about. But for now, we're able to care for her. I also serve as president of the Arc of Washington Board of Directors. So having the daughter that I have has gotten me involved. I also am on the Arc of Tri-Cities local chapter. And I am very involved with many people who deserve and need services in order to have a life. Like Chris just said, he's afraid he'd be homeless without the services. Well, there's a lot of people on the brink, and I am, you know, they're friends of mine. They've been on the board with me. They're people I worry about, and they're aging too, you know, so it's not just the little children with Down syndrome who we can easily love and care for. It's adults who are aging and their parents who need to care for them. So thank you, Diana.
Thank you, Nancy. Senator Schessler, would you like to address some of the things that you've heard about and the fears about what could happen with some of these proposed budget cuts? You need to unmute yourself. There you go.
Okay, we're back. You know, I've spent 28 years becoming fairly fluent in issues that affect your communities. I'll never be Maureen Walsh, who had the heart and the knowledge, but I have been through hard times before. If we go back to 2012 or 2010, we expected absolutely the worst. The sky was going to fall, and we had to do something. Well, in that 2011-13 biennium, we had $2 billion less, I think, than the prior biennium. Now, in this biennium, we still have, even after the tragic revenue forecast, but we still have about $2 billion more than we prior. So the sky has not completely fallen, but there are some avenues that have to be looked at. We cannot do anything but across the board unless we have a special session, period. And every month we don't have a special session, you cannot unspend savings you might have found, efficiencies you implemented, the things we like or don't like. We don't have a choice. So we are losing. So if we go back in January without a special session, 6 months of savings, efficiencies are gone. And much was said about the furlough plan for public employees. If you're making less than $89,000 a year, you will make more money in the month of July as a state employee than you did prior, and you get every Friday off. What a deal. It can be done, and it takes a line by line, item by item approach. In 2011, we did just that in policy areas. People that were not kindred souls worked together and achieved savings, and we got through it without the horribles that everybody thought we would see. Now, I'll give you one last example of what you can do. We cut 11% from the Senate budget for fiscal year 21. We didn't even break a sweat. But we can write our own budget, but we cannot adjust any other budgets. And while we're in tough times, it's not insurmountable, but kicking the can down the road till January is not going to help our kids that need help or their parents. So that's my general soapbox, and hopefully that helps you with your question.
Thank you, Senator Schessler. And now, Representative Rude, would you like to make a little talk with your constituents here?
Sure. Yeah, thanks. thanks to all of you for calling in and sharing your stories today. Jeanette and Nancy, the experience of being a parent and thinking about the future for your child is something that I think is really common. And I've heard from other parents that are also wanting to plan for the future and have concerns about services that may not be available. So kind of when we do go into session and whenever that is, and I agree with everything Senator Schessler said, as I'm the most bipartisan, nonpartisan guy that you'll meet. But in this case, there's a roadblock, and I think it's important to say it because it's true, and it's the majority party is not allowing what needs to happen, and it's extremely frustrating because your experiences are real. You're real people that have genuine concerns about the well-being of your family, and they're threatened to this point. And so I think it's important for us to address them as soon as possible. And just so you know, kind of what my priority is going into a special session or the regular session in January. People who are vulnerable, like I said in my opening, are my first priority. Public safety, individuals who can't provide for themselves or need assistance. And, you know, Jeanette, you had mentioned kind of the cost savings that I think Senator Schessler and I are very aware of when family members are providing the services for their family. That's the most cost-efficient way of providing services, and we need to acknowledge that. And thank you for that. The service that you're providing. I know it's really difficult, and I will never fully understand what it's like and the challenges that you face. So thank you for doing that. I know that that kind of service is the best placement for an individual with disabilities to be with their family, and for the state to allow you to be in a position where you can provide those services versus outsourcing them. So all I can say is that DD issues are a priority for me, along with another handful of issues that I think need to be preserved in any kind of budget situation. I'm starting to ramble, so I'll just stop there. But that's kind of where I prioritize.
Thank you, Senator Schessler and Representative Rue. This is Stacy Dim again from the ARC of Washington State, and thank you again to our speakers, Chris and Jeanette and Nancy, because I know it takes a lot of bravery to share your story and to do this in front of a lot of people. I do just want to take a minute to recognize that we do continue to be knee deep in a pandemic, and we're all tired in many ways, in different ways. Some of us have experienced COVID ourselves. Some of us have lost loved ones to the virus, and they're grieving. People with developmental disabilities are 4 times more likely to be infected in our state, and they're 3 times more likely to die from COVID. There are many people with intellectual and developmental disabilities who have underlying conditions, who live in group settings and congregate settings. And during this crisis, this COVID-19 crisis, what we know is it's become much more clear that the ability to receive services at home and be cared for in the community is critical to keeping people safe and healthy, and to stop the spread of the virus. And unfortunately, there are just multiple barriers that exist to getting adequate access to home and community-based services. We lacked an investment in our state and community-based services before COVID-19, and now we face some of the most historic and unprecedented cuts in history to these services. I mean, we recognize that as public servants, you're going to be making some extremely difficult and courageous decisions in the near future. And this could be one of the most challenging times to be a legislator. We also recognize that you're both on budget committees, and we really think the state budget is the most important piece of legislation that our state leaders act on. It's the place where we decide what we're investing in and not investing in, who we protect. We know talk is cheap, that where the money goes is really how we reflect who we are as a state and what our values are. So we're hoping that you're going to help us address some of the underlying inequities that existed even before COVID-19 in our state. We're hoping that, you know, if ever the word special matters, that it'll be now. So I'm wondering from each of you, I know Senator Schessler, you mentioned a budget shortfall. Our understanding is that the budget shortfall is somewhere around 8.8 billion, and that we have about 3.5 billion in a rainy day fund. It seems impossible in that case to cut our way out of services. And we know there's been a lot of talk about revenue and what that means. I'm just wondering if you could share your thoughts about that. And is there a way to protect DD services, for example, out of the rainy day fund? Is there a way to generate specialized revenue that might protect our community? And what are your feelings about doing that specifically for us? Let's start with you, Senator Schessler.
Okay, well, am I live again?
Yes, you are.
Okay, just checking. You know, I think it's, you take one bite of the apple at a time. And if we froze, not cut, every salary of every public employee, legislators included, governor, eliminated step increases for the first year, with the reserves, you could have essentially a zero cut budget for everybody. Now, we probably do need to look for some savings and efficiencies, but that's the start. By authorizing, allowing the 3% increase to go through on July 1, the governor increased the bow wave into the next biennium. So go back to what I've said for months, when you're in a hole, you quit digging. This is manageable. It's not easy, but every month we wait, it continues to get worse. Now, you look at some of the potential efficiencies. Yeah, we probably need to make some efficiencies in the RHCs. We need to consider how government works. Governor Locke called it priorities of government. But to simply say, throw your hands up in the air, and what you're likely to see in the near term are very, very regressive taxes. Some of the grand ideas of progressives would take 18 months or longer to implement. So what you look at are the most regressive taxes: sales tax on services, B&O. Really not good policy. So we have a chance, but if we kick the can down the road, it's only going to get worse. And unfortunately, people with disabilities are often the pawns by bureaucrats and some politicians.
Thank you, Senator Schessler. Representative Rood, did you want to add to that, or do you have other ideas?
Sure. No, I agree. I think there's going to be a push to generate more revenue, additional revenue sources, and you know, I think a special session should have happened already. The efficiencies and the cutting, for all the reasons that Senator Schessler explained, needed to happen a long time ago. And the longer we postpone doing that, the bigger the hole will be. And I fear that the stronger the push will be for example, an additional payroll tax, capital gains tax, other income tax options. And I don't think that's the right approach. I don't think that helps an economy recover. So really kind of reopening the economy and starting that revenue flow is what we need to do to address that problem. And the sooner we do it, the better. I mean, shutting off the revenue and continuing to spend at the same level is simply illogical, and I think we all know that. So that's what needs to happen. It's not, I'll continue pushing for that. But that's really the solution to the problem.
And for both of you, you know, I'm looking at some of the questions that have come up here. You know, the idea of an efficiency in our community doesn't seem to make a lot of sense. There, you know, there are a few ways right now for us to do less. Sometimes you can do different, but doing less is probably just going to cause more hardship, add to the waiting list, add to people who are really having a very difficult time coping with what they get now. And as we mentioned, there's so many people who are eligible but don't get anything. Do you foresee that there's a way to save us from these cuts and to, I guess, in some ways make us special? And is that something that you've talked about even within your caucuses potentially, or is that an option? Senator Schessler?
Okay, thank you, Stacy. Zero is probably not going to happen even in a progressive budget. Efficiencies could include the RHC, something that has been, we closed an RHC in the first recession. I participated in as a member in 1993. So that's certainly out there. Can we not ask questions about how we deliver it from a huge bureaucracy in Olympia? A couple of the thoughts that came from other questions, Amazon, Microsoft, and Boeing moratorium on their tax exemptions. We actually raised Boeing's taxes last year, not because they were doing well or we wanted to, but because it was done to prevent WTO problems for other products from Washington. I will say that when the B&O tax was raised, the majority party and the governor allowed Amazon and Microsoft to cap their tax exposure. Nobody else got that. It doesn't seem real logical to me, but that's how the majority party operated. As far as another person, same person asked about a special session, I think everyone in Olympia said, yeah, we're going to have one. It's not a matter of if, but when. Well, now the governor, the OFM director, and members of the Revenue Forecast Council have all retreated from that position, which I've said over and over is the only way to avoid across-the-board cuts. And I think I understand the relationship of state and federal resources very well over the years, having helped write several budgets.
Thank you, Senator Schessler and Representative Rude. You know, we've often said that equal cuts for us are really not equitable given the state of affairs and developmental disabilities. Do you have other ideas about, you know, what we can do about that?
I agree. I agree with that statement. I think that you mentioned the equity issue and this population being disproportionately impacted by COVID too. And I think that it comes back to kind of how populations that I prioritize and prioritizing PPE for certain populations, I think is really important, as well as prioritizing in the budget. So coming back to your question about the 15% budget exercise that I think has a lot of people alarmed. That is just a budget exercise. I don't think that there's going to, I personally don't think there's going to be a 15% cut to DDA, and I hope there's not. But there needs to be a thoughtful kind of line by line approach to budget reduction. And that's really the only equitable way to approach this community and other communities when it comes to budget reduction. So I guess that's my position, is that we need to be thoughtful and not do across the board.
Thank you. And there's a couple of other comments on, you know, so if I think the majority of people in our community are very much in favor of reductions and consolidation of RHCs. But in order to do that, we still need an investment in community services, in places where people would live separate from those facilities. And so it's hard to imagine how we accomplish both, cutting across the board and investing more in the infrastructure of home and community-based waivers and community-based services. Do you have thoughts about how we can do one without the other?
I don't think we can. If we're moving away from RHCs or higher cost services and transitioning to lower cost services, it's a cost shift. So we can't defund and leave it at that. So and I think that conversation would be part of that. That conversation isn't possible without that kind of budget approach that I talked about. Across the board cuts aren't going to lead to any kind of thoughtful approach to that issue, which, as you can see, there's kind of a theme here. All of these approaches that we're talking about and the things that we could partner and do require legislative action through a special session. And that's the way the process is set up, and that's what ultimately has to happen. So that's kind of where we are right now.
Yeah, Senator Schessler, we talked, you mentioned, I think, there are a lot of places in the budget that are constitutionally protected. And in our community, we know that developmental disabilities is mentioned in the Constitution. It didn't look like that in the beginning. Those are not the words that were used. There were some pretty damaging words that were used that have changed since. But it's hard to imagine that the writers of our state constitution intended to protect lands and buildings. That it clearly protected the people with developmental disabilities. And while we haven't had a lawsuit yet to completely make that clear, there is a lot of talk when we talk about RHCs as those being maybe constitutionally protected, and we often talk about shifting that view. There's probably the people with developmental disabilities that are constitutionally protected. Is that something that you've talked about or thought about? And will it take a lawsuit really to make that clear, or do you think it would be clear enough based on the information we have and what the Constitution mentions for people with developmental disabilities?
I gave up trying to predict the courts and constitutionality a long time ago. Not a dodge, but just I've kind of given up. I do know if I look at my personal priorities of government, if you go back to the 7 trusts that were set up at statehood, they don't use the term disabilities, but it was referenced in a term used prior. So it was one of the 7 trusts set up as a priority. Now, is that the Constitution? Who knows on a given day with this court? I've given up on that part, but I think we've changed a lot of attitudes over my service, and we'll continue to.
Thank you. And Representative Root, would you have anything to add to that?
Probably not. I don't want to be repetitive. So, and I haven't read that provision of the Constitution recently, so I probably should just not.
Yeah. One of the things that we talked about, I hear legislators regularly say to me, oh, this was going to be the year for DD. We were really going to work on some big overhaul and changes. And one of the things that comes up regularly for us is the issue of caseload forecasting. In our state, developmental disabilities is one of the few services that does not get caseload forecasted. And while we understand what that means in terms of the budget, there's been a reluctance to do that. And James Kettel, if you're on still and you're able to jump in, you might be able to share a little history about caseload forecasting and where DD might fit into that. But I'm curious then in the end too, for both legislators, if that's something that you think might be part of the solution to part of the puzzle piece that we're looking for. James, if you're still on, are you able to share a little bit of the history there?
Hi again, everyone. So a portion of DD services are forecasted, and that would be personal care services, services provided in in-home settings, individual providers, home care agencies, services provided out of the home in adult family homes and adult residential care. So that is only a portion of DD services. There's also a forecast of per capita costs for clients living in out-of-home placements like supported living or group homes, and several other smaller residential services. And that adjustment to per capita cost is provided as a maintenance level or a more automatic adjustment in the budget. It is true that other aspects of the budget, including in DSHS for the aging and long-term care programs, have more forecasted services, things like nursing homes and several other entitlement services. And the difference there is the idea of what is considered to be an entitlement or a Medicaid state plan service. And in DD's case, quite of the budget is still provided through waivers, and the waivers are not the same as having a state plan service. So that's my understanding of some of the breakdown and the history. Happy to take questions if people have them.
Great, thank you. And so, the waivers have proven to be particularly important along with in-home care in COVID, because we know that congregate settings are the last place you want to be right now during the pandemic. And so Senator Schessler and Representative Rude, we're hoping that you'll be able to support making those stronger and looking at making sure that those are a viable source of services and supports for people in our community. Curious if you had anything to add to what James has mentioned about caseload forecasting and how you think that fits into somehow protecting us in the future.
I'm just glad we have somebody so knowledgeable available.
He's very knowledgeable, that's for sure.
I don't have anything to add. And I also very much appreciate staff that make this whole thing possible.
We appreciate that he's available too. And my hope is in one of those great briefings or presentations he does, he'll be available to do one on caseload forecasting and how waivers have developed in our state and kind of where they lie when we're in this position of looking at efficiencies and cuts and what that really means. So I'm looking here at some of the other questions. There are some people that want to make sure that you both know that we are ranked 41st in the state for services and spending on people with developmental disabilities. And certainly that's not a great statistic to be all that proud of. And that, when we look at the cuts to DDA that were part of the exercise, it's important to recognize that those all come with federal matching funds. So if you cut 140 million from the DDA budget, it's really a cut of 280 million. And we're wondering if you see that the value of those federally matched dollars is different from dollars in other programs that you might cut if you're doing more of a selective slice of the budget, and what your approach to that might be. Senator Schessler?
Well, I think that's one thing that my colleagues across the aisle and myself understand budgets. The people that actually work them understand that you're really taking a double cut. And I would say that that doesn't know any party lines on why there's a downside.
Thank you. Representative Rude?
Yeah, I think it's important to take advantage of matching funds. I think approximately half of our operating budget is matching dollars from the federal government. So I think prioritizing DD services and kind of thoughtfully cutting, I think is what we need to do. I was just reading a question here, how we will advocate against DDA budget cuts after hearing these stories today. And I'm not as involved in the budget as Senator Schessler, but I am assistant ranking on the Appropriations Committee in the House. And so I'm a little closer to the budget conversation than some of my other colleagues. And I think it's just important to prioritize DDA and make sure that the dollars are really flowing to people. And if there are cuts that need to happen, those need to happen in ways that don't impact you as individuals and the people you're caring for. So looking at kind of administrative costs and savings there, I think is what needs to happen before impacting services and the dollars that are going directly to individuals.
Thank you. You know, Representative Rude, you mentioned that you're always willing to reach across the aisle, and we recognize in our community that these have to be bipartisan issues. Disabilities affect everybody. It doesn't cut across political lines. Mm-hmm. And we recognize this is an unprecedented time that will take absolute cooperation between political parties and between the House and the Senate. And I guess I'm curious how we can help both of you to facilitate these productive, important conversations across the aisle. If there are legislators that you're hoping that will work with you together in ways that will help protect the developmental disabilities community, and again, what we can do to support you. Have you got any thoughts about that?
Sure. You know, and I think kind of addressing another question that I saw in the chat, keeping partisan politics out of the conversation and not bashing the other party is what I'm reading. I just want to say, kind of point out that, and keep this in mind, that when we are calling for a special session to address these issues, we know that we're calling a special session of a Democratic House and a Democratic Senate to address these problems. And so in a way, it's almost the most bipartisan thing that we can do is to call this, as Republicans, we're calling the Democratic legislature back to Olympia to work together and address these problems. So I think the process is really important, and to have representation from all areas of the state in developing solutions is really what we're calling for. So as far as how people listening can help, I would contact your legislators and say, please work together and come back to Olympia and solve these problems. That's really my my wish at this point is for the legislature to reconvene, and if you can apply pressure, I'm doing that as much as I can. If you can also apply pressure to get the legislature back together to really start that conversation, I would certainly appreciate it.
Thank you. Senator Schessler?
It's all about relationships. People that are your friends, you know their stories. Really hard not to care when you talk to them. If you don't have, excuse me, some type of relationship with your legislators, you're just another number. So I would urge the continued relationship building and understand what legislators are going through, and hopefully they understand what you're going through.
Well, those are both remarkably thoughtful comments. I take to heart what both of you have said, because we agree with those statements, and we're certainly hoping that we can get answers sooner than later, and make sure that we're positioned well enough that hopefully there will be some thoughtful cuts across the state budget that will look at the very particular and unique situation that we're in. Diana, I was wondering, sometimes it's difficult for people in our community to type in their responses. Has there been anybody that's raised their hand that felt like they just wanted to speak their question? I think we have time for one more question, and then we're going to move on to how people can get involved and do just what Senator Schessler said, make sure to contact your legislators and get involved. But is there anybody that's raised their hand?
I don't see any raised hands yet at this point.
Okay. Well, we just always want to make sure we offer that opportunity. So on that note, I think, Diana, we've got a special section here now that talks to people about how they can get involved, how they can form relationships with their legislators, and I'll let Diana take it from there.
Thank you, Stacy. So we're going to move on now to what can you do, give you some tangible things. And we've got a little list here. So they're part of the PowerPoint, and this will be posted on our website after the presentation is finished. So you can always go back, look up these slides, and get information that you may have missed. And so there are links here to these different things, but we're also going to give you a visual so that you can have an idea of what you're looking for. So the first thing to do is get involved. And it's fairly easy to do. You can go to our website at www.arcwa.org and go to our Action Center under Advocacy. And you'll see we've already got over 3,000 people who are part of this program that helps get information out to people and helps make it easy for them to respond to things. So you can sign up and get involved there. And currently right now we have an action alert that you fill. It gives you information about these budget cuts that are being proposed and helps you to write a little message, an email message to your legislators. And so that way you can communicate directly with them about what it would mean if these cuts are made. And then the second one is a petition. We've got almost 2,000 signatures now at this point that will go to the governor and let him know these budget cuts would be disastrous to families and individuals with developmental disabilities. And Emily, this is a toolkit put together by the Developmental Disabilities Council. And so I'm going to have Emily explain that a little more to you.
Hello. This toolkit has a lot of information within it for you to access. There's things around social media and some hashtags to use if you're going to post on social media. I know Facebook is a really well-used way of communicating these days in these circumstances. And so there's several different ones. Vote DD, there is no Plan B. There's videos on here that can be shared about how the cuts will impact folks. There's images to use in your social media post. And then if you need some assistance with your social media posts and maybe an example or two, you'll find those there. The messaging that you use is really important because you want to keep it as plain as possible. Lots of times in our community, we start to talk in some jargon sometimes, but it's really important that we keep our comments as simple and to the point as possible. This way, everyone will understand what the impacts really are. And when you think about where you might share your message, there's a little list there that talks about where you could share your message, share your thoughts at community meetings, social media, talks with your friends and family. There's also a little further down, there's supporting documents and letters that'll give you a little bit more in-depth information. And then on the furthest column, there's some templates to use if you're wanting to write emails or make phone calls so that you can have examples to make it easier when you contact legislators so that you can have a really clear message and get your point across easily. So, and hopefully you can access this after the meeting, and there's just a lot of information there that hopefully can help you to advocate easily. Thanks so much.
Thank you, Emily. And now we'll have Jessica talk to you about some ideas.
Be sure you know which district you live in. You can find it by going to the legislative website shown and putting your address in the form. To email your legislator, it is the same format for them all. You just need to know their first and last name, which you can also find on the legislative website.
Thank you, Jessica. So we've given you some ideas about what you could be doing. There's also groups, that you can join. Self-advocates have many groups. They're on, we're looking on Facebook and Twitter, YouTube for all types of ways that will inform us as well as help us get involved. So now what can you do? We're going to ask you this specifically. You've got all these ideas that we've just given you, and we've got a second poll here that we're going to share that asks you, what will you commit to doing? So you'll see this on your screen now. You could maybe respond to the ARC's action alert or sign the petition. You might use the advocacy toolkit. You might call or email your legislators, post some of your concerns on social media, on your Facebook page. Maybe join an advocacy group, one of the self-advocate groups or parent groups. There's lots of ideas for those. And if you need help with ideas of how you can get involved, you can always contact us at the ARC. My email address is Diana, D-I-A-N-A, @arcwa.org. So feel free to email me if you have any questions about how you can get involved. The first step I would say is join the Action Center, and that puts you in the ballpark of advocating at that point. And when you get a little message that says, we need your help to advocate about this, it's usually going to be directed toward your legislators. And the more that you send them information, the more they're going to recognize you and what the needs are of you and your family to them. So we still got people filling out the poll here. A lot of people, it looks like the most of them are going for calling or emailing your legislator, and that's an easy thing to do. Jessica gave you the formula for emailing a legislator, or you can use the Action Center and send your message that way. So it looks like we've pretty much finished putting into the poll. So we have 70% have said that they want to call or email their legislator. The action alerts and the petition, both of those have gotten big results too at 60%. And then social media at 50%. So these are ideas of how you can get involved. And like I said, we'll be putting the presentation on our website under this day on the advocacy days. If you go to arcwa.org and click on advocacy, you'll see advocacy days, and all of our virtual advocacy days, the actual video from today, as well as the presentation, will be posted on that page. And one of the things we've started doing is adding closed captioning. So last week's virtual advocacy day is posted on there, and it has closed captioning. So if you need some help with being hard of hearing or anything like that, this will assist you and make sure that you understand all the things that are being explained to you today And in the future, we still have 3 more virtual advocacy days to go. So we encourage you to join us here again next Thursday. And I'm gonna wrap it up with having Senator Schessler and Representative Rude give any last comments, or if you have other ways besides the ideas we've given people about how they can be active, we'd like you to share those as well. Senator Schessler.
Well, thank you, Diana. If I can be blunt, sometimes I'm not a fan of petitions. They're just too easy. People don't think. And a genuine email or snail mail gets a lot more input in members' offices. We got paste form letters coming out of our ears. Skyler can tell you as a former staffer how much time it takes. Krista in my office has been around for a long time. You get back what you put in. If you send an original message with your questions, your concerns, you get back a lot more. It's not that the other things aren't useful, but you shall receive what you put into it. One of the questions was the other Washington coming along. I will say that, yes, there's going to be more federal money coming down because of the unprecedented hit on our economy. And we can guess economic, small business stimulation will be there. Some of the healthcare concerns, I'm sure, will be there. What I wouldn't bet on is a direct bailout to the states to reduce their deficits, fund their broken pension systems. I think it'll be more targeted. So some believe that's a reason for waiting. I disagree. I just don't think it's going to be the windfall that some would expect and reason to put off hard decisions. So thank you to constituents and friends on this call for allowing me to join you. Thank you.
Well, thank you so much for being here with us, Senator Schessler. And Representative Rude, would you like to make any last minute comments?
Sure. I really appreciate the opportunity to be here. I think something that wasn't mentioned is to include Governor Inslee in your advocacy. He does have the power to call a special session himself. And so I would just include him and let him know that kind of where we're coming from, and if you are a supporter of getting the legislature back into Olympia to start that process, I think it's in the best interest of DD Services to do that. And I would also include Governor Inslee in your advocacy on that issue. But I posted in the chat, I really think that especially caregivers are heroes. What you do is extraordinary. And so thank you for the valuable services you're providing, and to everyone else who's an advocate. Thank you for that service too. It provides a lot of value, and it really impacts real people. So thank you.
Thank you. I thank you both for joining us today, and thank you all to the constituents who have joined and shared their stories and asked questions that make people think. And just as kind of a little add-on, the action alert on our website is actually, they can choose to send it to the governor as well as their legislators. So those of you who go and fill out the action alert, that can be sent to the governor as well. And the petition is designed specifically for the governor. That will be going to him and the budget chairs. So there's a lot of ways, some of them really easy, some, you know, like Senator Schessler said, signing the petition is pretty easy to do. You know, filling out the action alert takes a little bit more time because you got to think about what you want to share about your personal story that is going to catch your legislators' attention. So thank you everybody for joining us. There will be an evaluation that comes out by email We hope that you'll fill that out and help us make these better every time. This has been kind of a new thing to do because of the COVID pandemic. And so we still want to make sure that we are reaching out to legislators and helping them hear from you, their constituents. And so join us again next Thursday, and we will educate some more legislators and take some more questions and make an impact, because every one of you has a voice that needs to be heard. Thank you for joining us. Bye-bye.